Okay, it's Dr. Rosenberg again, here to talk about one of my favorite topics, fibromyalgia. First of all, does it exist? Something exists because there are a lot of patients that have that diagnosis. There are at least 3 fibromyalgia magazines and several medications that have been developed specifically for fibromyalgia patients. So I think that argument's probably pretty much over. Again, in rehab medicine, I approach these things with the concept that I cannot cure it. I cannot take your fibromyalgia from a 10 and make it a 0. If I can improve it 3 or 4 points, then that's a big result for us. In physical therapy, one of the problems I see with a lot of fibromyalgia patients is they come in and they say, oh, I had physical therapy and it was horrible. And when I ask what they did, I find out they were given very vigorous exercises to perform. Well, a fibromyalgia patient, it's a muscle disorder. You have to be very careful not to over-exercise those muscles or they shut down. So you have to exercise the patient, but you have to do it within a restricted range, and that's why frequently a therapist is needed to show the patient how far to go but not injure them. We can do injections for fibromyalgia. It's been shown to be very helpful. One of the pathological features of fibromyalgia is the muscle tightens, and when the muscle tightens it develops some scar points referred to as trigger points. And in fact, you need, I think, 12 trigger points now to actually meet the diagnosis of fibromyalgia. But the point is, you have these trigger points in the muscle and they're bound up scar tissue, essentially. And exercise alone is just not enough to break those adhesions. In that case, an injection can be helpful. But an injection alone isn't enough. You need an injection, break up the adhesion, followed by stretching to get the muscle to relax, followed by proper strengthening, so now the muscle stays strong without that trigger point in it. So that's where this combination of healthcare professionals makes our program much more efficient, because you can get the medicine, you can get the injection, you can get the right therapy and the right home exercise program all in one place, all at one time. What about the injections? The injections are usually a combination of lidocaine and some kind of steroid. Local topical injections are very safe and nothing really to worry about. What about the medications? There's been a whole series of medications that have been designed for fibromyalgia patients because they work by taking out the transmission of the pain signal through your nervous system before it reaches your brain. And that can be very effective. The most common medications now being used include Lyrica and Savella. And once again, I think that if you get the proper treatment and the proper medications, you will make improvements. Now, the new thing in fibromyalgia is the discovery that there is one very consistent finding in fibromyalgia patients other than the muscle pain and the trigger points, and that's sleep deprivation. We know from studying sleep patients that if you don't sleep, you don't do well medically. You don't heal. Sleep is when you heal. So sleep disturbances in fibromyalgia patients is almost across the board. So in addition to the fibromyalgia medicines, I've started using more powerful sleep aids, and the results have been very dramatic. I'm happy to say that most of our patients improve. It's only a question of how much. Dr. Rosenberg saying goodbye.